Happy, healthy, beautiful day to you guys. Eric Higgins here, holistic health coach and actor calling out of Portugal. And on this call today, we're going to be talking about reducing hypertension with medicinal mushrooms. We're joined by Dr. Bob Rakowski, global health expert, 33 years of clinical practice, helping people to come back to their best health, whether that's elite athletes or if it's regular people who have been given some information from their doctors that isn't so great, but thankfully got some good information from Dr. Bob, really addressed root cause, and now are living their absolute best life. And today we're going to be talking about hypertension. What is hypertension? Do we need to be concerned about this issue? And what exactly does it present as in our life? And more importantly, what are some of the strategies that we accomplish and apply in order to create our best health, address root cause, and bring ourselves back to our best state of health? So, Dr. Bob, welcome to the call. Great to have you here.
First of all, welcome back from Ireland. Welcome back from your sister's wedding. I know you were contributing to the wonderfulness of the world while you were there, but good to have you back.
Well, thank you so much, Dr. Bob. It's good to be back. This is going to be an epic year ahead, guys. We're on a mission to impact the lives of 100,000 people around the world, sharing strategies that actually work, that get the job done, so to speak, or as one of your former or continuing patients, Evander Holyfield, will say, is the real deal. So we want real deal solutions in these calls, guys. And we're going to be addressing challenges that you can foresee in your life or maybe families, and also give them some good advice. Maybe you can share these calls with your family and friends if they can't reach this in this time zone. And you can also go onto Dr. Bob's YouTube channel and check out the replay as well. But Dr. Bob, you've excelled as a functional medicine doctor. And for some of you guys who haven't heard of functional medicine before, this is the first call with Dr. Bob. Could you just share really quickly, Dr. Bob, what is functional medicine and how does it compare to what people would know as traditional medicine?
I'm going to give the funniest answer that I heard, but yet is somewhat accurate as well. David Perlmutter, he was the only neurologist, also certified in nutrition, best-selling author, just an amazing guy. Has a great podcast too, but he said, essentially, functional medicine is the opposite of dysfunctional medicine. And he says functional medicine actually looks at root cause and helps the person to get better, to tap into the healing powers that are in their body and in nature. And where drugs are appropriate, they would use those as well. Whereas dysfunctional medicine says, there's one solution to every problem, and that's a drug. And even though it doesn't solve it, maybe you'll think you'll feel better for a period of time while you're actually getting worse. And that's kind of a harsh statement of what dysfunctional medicine is. Are there good uses of drugs? Sure. Are there good people to use them? Absolutely. But I think the world is seeing that relying on drugs and ignoring all the beauty of natural medicine, functional medicine, not a good idea. Leads to big problems.
It sure does. And one of those problems we are seeing, not necessarily stemming from medication, but certainly it's being recommended in often cases to put a Band-Aid, so to speak, on the condition rather than, as you mentioned, looking at root cause. But what is hypertension and why should people be concerned about this occurring in their life?
Yeah, if we break down the word, we're hyper, too much tension, too much tension, too much tension. Where? How about in the vascular system? I let people know we have 60,000 miles of blood vessels. And we have this amazing pump in our chest called the heart. And you know what? It's going to beat 24/7, 365 for the entire time that we're on the planet. But we can overwork that heart. It's very simple. And if you have too much tension in the bloodstream, you make that heart work harder every single beat and essentially wear out faster. And where high blood pressure gets to be a real problem is it actually is a problem that in and of itself will increase if not addressed. So there's a muscle inside the arteries. And if you have a muscle inside a tube, if that muscle grows, it doesn't grow outside the tube, it grows inside. So the tube gets more narrow. And, if you know anything about fluid mechanics, if you start kinking the hose, you dramatically increase the pressure. And that's what we see. And so that's going to put a strain on the heart. It creates a greater probability of clotting. And they call it the silent killer because unless it's really high, most people don't even know they have it. And part of that is it's because it comes on very gradually. You don't wake up one day with extreme high blood pressure unless there's some major pathology going on, which is not almost, 99.999% of the time. That's not the case. But over time, just the wrong habits, the wrong strategies lead to high blood pressure. And sometimes it's, a little too late when it's even diagnosed. So it's something we want to be aware of really throughout our life.
Leaning towards this earlier on the conversation around the medical protocols for this. A lot of people will go to their GP and they will be given a medication for this challenge. In those instances, Dr. Bob, what are some of the typical medications people would be recommended to take? And what are some of the side effects that perhaps some people don't even or aren't even aware of taking these meds?
So first and foremost, one, when they're given medications, they have a lot of different ways of going after it. They can work with the fluid system. So they have things called diuretics. And if you're peeing more, you're going to lose more water. You're going to lose more electrolytes. And I might ask the question, why is your body's fluid balance not working? They have something called an angiotensin converting enzyme inhibitor, and angio blood vessel tension, the tension within it. And there's an enzyme that says, hey, tense the blood vessels, but your body does that on demand based on need. And if you give that, you start to block that enzyme. And what's interesting is drugs always have two effects: the effect that you're trying to create with it, and then the body's response to it, which, by the way, is almost always opposite. So with that said, keep in mind, if you're taking a blood pressure medication and suddenly stop, usually your blood pressure goes through the roof because your body thinks you need that higher pressure. And I actually want to get to the diagnosis of that in a moment as well. And while we're talking about angiotensin converting enzymes inhibitors, otherwise ACE inhibitors, understand that it was the ACE receptors that made people more prone to the COVID virus. And one of the risk factors was taking these particular drugs that made them more vulnerable to serious COVID infection. And then they can even address directly the heart. And sometimes, by the way, they use all three, where they say, okay, we want to slow down the beat of the heart and slow down the intensity of the heart. And what does that do? It gives you less cardiac reserve if you need it. And so we don't want any of those things to happen. But Eric, here's a fascinating thing. When people come to my office, I'm going to take blood pressure on every new patient. I take it lying down first, and pressure should be lowest because you don't have to pump against gravity to get it up into your brain. And then I also test it with people standing up, and it should rise actually 6 to 10 points because for a very short period of time, the heart has to work harder to get blood up into the brain. Now, I had a 50-year nurse in my office, and I took her husband's blood pressure lying down. And when he stood up, he was so dizzy, I had to hold him up so he didn't fall. And now she looked at me and she said, my gosh, I've never seen a doctor do that. And I said, do what? She said, measure blood pressure lying and standing. And you might ask yourself that question. Have you had a doctor do that? Because I do it on every patient. And I asked her, I said, how were you taught? She says, just like that. And I said, why don't you think doctors do that? She said, well, I guess it just takes too much time. Now, the reason I go through this is, one, patients are worth the extra minute. But two, often if the blood pressure is going to drop from lying to standing, which is essentially an adrenal problem, a chronic stress problem, then the body is smart enough to elevate the pressure in the lying position. So from lying, it should be lowest. They stand up. If that pressure drops, the body says, I can't afford that drop. I might fall. So it elevates the pressure. Most in the lying position, but second most in the seated position. And most of the time, pressure is only measured once, and that's in the seated position. So if they don't get a dynamic issue, they may get a false impression that the individual has higher blood pressure. And as we talked on the way in, here's the published stat. 37.5% of people that have high blood pressure in a doctor's office don't have high blood pressure when they're in a more relaxed environment. So if we put you under situational stress, your body should increase your blood pressure because you want more blood available to the muscles to either fight or flee. So there's a lot wrong with the assessment. There's certainly a lot wrong with the treatment. And there could be a lot right with figuring out things early and going after it in a healthy way.
And just on that, Dr. Bob, because that just blows my mind that the testing is different and the actual laying down causes that increase as a very responsive system in the body to compensate for those things. And it's not taken into account. Surely there's many people that have been put on these medications because they had false readings, and I'm imagining maybe in a doctor's office.
Yeah, way too many. Way too many. And by the way, how long are they told they need it? Typically their entire life. But that's just not in their model.
Yeah, and I will just touch on that point in a moment, but just going a little bit deeper on that, are there, for some of these meds, Dr. Bob, do they have particular side or direct effects, as you like to say? There's no such thing as a side effect, it's a direct effect of taking these synthetic meds. Have you seen anything that's contraindicated to health, taking a lot of these meds that could have been avoided?
Well, always, so a drug without a side effect is not a drug. So let's go with the diuretics. In Chinese medicine, your water is your youth, but they're saying, you know what, we're going to get rid of your water. But it just doesn't get rid of the water. It also gets rid of electrolytes, and so then they have a new category called potassium sparing diuretics, because when they start losing potassium, that's at risk for a lot of different functions, but especially cardiac challenges within the body. Then you start looking at the angiotensin II converting enzymes. Your body's going to upregulate that enzyme because it made it at the level for a reason. But we also said that made people, this is easy to verify, look at ACE inhibitors and the risk of COVID. And it was a serious risk for serious COVID and even death. Then you start looking at the cardiac drugs in and of themselves. Over time, you shut down cardiac output. The systems of the body that need the blood aren't going to get enough. But I'll share a story that when they started measuring numbers, they begin to realize that as we get older, and you're doing that gracefully, so well done there. But some people don't age so gracefully. But I tell people, I'm approaching 60. It's going to happen, in where am I at? Less than 20 months or 20 months away from 60. That's close enough. But here's what I can tell you. My hamstrings are not as flexible as when I was 12. My eyes are not as flexible as when I was 12, so I needed reading glasses. Neither are my blood vessels as flexible. So my body may need to increase the pressure. Now, thankfully, mine doesn't. I run about 110/70 always. But if my blood vessels are less flexible, what that means is I need more pressure to deliver oxygen and nutrients to the critical tissues of the body. And so there was a study. Now, the first demographic they looked at was people that were over the age of 85. But they found out very simply, when they gave people over the age of 85 high blood pressure medications, they had fewer heart attacks and strokes. So that was their victory. But they died earlier than people that didn't take the medications. So the conclusion of the article, it called this out. It said they die earlier. So here's what they said. Maybe at an older age, we need more blood pressure to deliver oxygen and nutrients to the critical tissues like the brain. And maybe after 85, our ability to deal with the toxic effects of the medication is compromised. And I'm going to say all the above. So, when we start looking at what's called evidence-based medicine, we're seeing that evidence is not on the side of giving people long-term drugs, but it's always on the side of getting people healthy in the long run.
We should definitely do a post just on that alone, Dr. Bob, because hearing that, I mean, you mentioned about the fear earlier, the white coat syndrome, as you mentioned. I hadn't heard that. Was quite funny, of the anxiety of going to see the doctor or going to see the dentist, or anyone in a white coat for that matter, creates that trigger for people. And if people, as they're developing in their years, start to gain more knowledge and understanding of how the body shifts, then the concern of, oh, my blood pressure is elevated slightly, shouldn't be much of a concern. The focus should be really on the lifestyle choices. And that leads me on to the next question, Dr. Bob. That's a great topic. We definitely do a reels on that for sure, because people need to know that and share that with their family members who are advancing in years and who may be worried about that conversation. But if they go into their GP and they're armed with that knowledge and understanding, then maybe they won't be put on these meds that could over time shorten that lifespan unnecessarily. Whereas if they had that knowledge, like I said, they would be in a different position of posture and understanding. But when it comes to reversing the conditions for hypertension naturally, Dr. Bob, what are some of the lifestyle choices that you would really focus on in your clinic looking at root cause?
Well, let's look at what's correlated with high blood pressure. First and foremost, every tissue of your body needs blood vessels, needs oxygen, needs nutrients. So as you get more tissue, in other words, you get more body fat, then guess what? You have to increase your vasculature, and therefore you increase the strain on the heart and the pressure. So weight is directly related to blood pressure. Now, interestingly enough, fat is not the same as muscle. But here's the downside. You can actually have too much muscle. And so that would be super physiologic doses of muscle. So I'll share, a wonderful human, and nothing to say about his character. An individual named Anthony Clark was the first guy ever to bench press 800 pounds. And I joke, and this will be a funny story. So in my gym rat days, I show up at the gym, and I was there at the same time. Anthony was there, all at the same time. And the gym was crowded. So I'm getting on the bench, and Anthony looks at me and says, "Do you mind if I work in with you?" And I'd seen him lift before, and I said, "Listen, if you think you can keep up, you're welcome to work in," right? Okay. So my gosh, I mean, we spent more time putting on multiple plates on each side. Like his sets were 6 plates per side, and on a big set, I was doing 2 plates per side. And we're talking the big ones, right? The 45s. And I just looked at him. I said, "My gosh, how in the world do you do that?" So picture he was my height, which is 5'7". but he weighed 365 pounds.
Ooh.
And now, he was quite strong, and the vast majority of that was muscle, even though power lifters often tend to have a pretty big abdomen because it gives them better support for their squat and deadlift. But Anthony never saw his 40th birthday. He died of congestive heart failure. And so what I tell people is we're not gorillas, and we're not meant to have gorilla muscle mass. And when you get that far beyond, you can create a challenge for yourself. So keep in mind, most people, that's not the issue. It's too much body fat. And so you start increasing the body fat. And there's so much in the literature, but it's estimated that a pound of fat may increase vasculature by as much as 200 miles. Now, there's other problems. As you become progressively fat, you become progressively inflamed. So body fat makes a number of different things called adipocytokines. A number of them are pro-inflammatory. You're more likely to be insulin resistant. Insulin causes, and I'll give you the exact language from the literature, sodium reabsorption from the distal tubules of the kidneys, meaning that it's going to increase the minerals and blood volume within the body. That's going to raise the pressure. So you got more tissue, more pressure, more inflammation, more fluid, and that's a perfect storm for high blood pressure. Then you start throwing in things like vitamin D, which, by the way, is a natural angiotensin II converting enzyme inhibitor, and therefore is good for lower blood pressure. And then we begin to realize that the darker our skin, the less vitamin D we make. So people with darker skin are more prone to high blood pressure. And by the way, more prone to diabetes as well, unless they keep that vitamin D status in good shape. But if we look at the big four, stress, does that contribute to high blood pressure? You bet. Toxins, does that contribute? You bet. Malnutrition, does that contribute? You bet. How about physical inactivity? All of the above. So the deadly quartet, those are all things, lifestyle strategies that we can improve upon to make blood pressure improve or even high blood pressure go away.
Wow, that's a lot of knowledge in there, a lot of bombs in there, and other reels for sure that we can create from that. But guys, I hope you're taking your notes, and if not, you can go back and watch this call because there's so much info with Dr. Bob's knowledge set that he can really blow some of you guys out of the water. What was that? But so great to start to get an understanding because there are so many nuances at play. The body is such a unique machine, and it's really designed to work well if we work well with it and give it the conditions or help create the conditions for it to absolutely, keyword of the day, flourish. But when it comes to medicinal mushrooms, you want to talk about the power of these natural superfoods, these natural wonders, if you would, that are in nature, that are designed so beautifully, so perfectly, that they really help us to come back to our best state of health and balance. But through what mechanisms specifically, Dr. Bob, can medicinal mushrooms help with hypertension?
Twice we mentioned angiotensin converting enzymes. So specifically, reishi is an angiotensin converting enzyme modulator. We mentioned insulin, pre-diabetes, causing the reabsorption of sodium from the kidneys. And it's good for insulin signaling and, actually reversing diabetes, pre-diabetes by at least half a dozen different mechanisms. We talked about the potential challenge of inflammatory process. By the way, which one of the things that creates is fluid retention. That's one of the cardinal signs of inflammation. It's anti-inflammatory by over a dozen different mechanisms. We talked about stress possibly inducing high blood pressure, and it calms stress. And this is the amazing thing in the body, mind, and we have people that, it's kind of amazing to them. They might be on edge. They're at the office. Maybe it's their first visit. They're having an issue with high blood pressure. I will often give them a reishi-infused beverage, whatever their choice is, whether it's coffee or tea or cocoa or whatever. And then often during the visit, I'll ask them, how do you feel? They go, you know what, I feel really good. I said, how's your spirit? Are you calm? Do you feel like you're on edge? No, I actually feel pretty relaxed. Let's measure your blood pressure again. And that, by the way, could be a counter test to the white coat syndrome because for most people, they have such a significant calming with that they instantly we can measure the difference, not instantly, but 20 minutes, 25 minutes, close enough to instantly. And they come to realize this could be really, really good. But if we went with the big four, reishi is going to buffer stress. It's going to help the body clear toxins. It's got all the fabulous 50 nutrients. And by the way, even though it doesn't have a megadose of vitamin D, requires healthy skin, sunlight exposure, healthy liver, healthy kidneys. And here's what we know. Reishi is good for the skin, good for the liver, good for the kidneys. And who knows, maybe you'll even feel good enough to get outside and get that good dose of sunlight, which has more benefits than we probably ever know. So across the board. And then, by the way, it's great for mitochondria. So people have more energy, they have less pain, they're likely to move more, and therefore achieve an ideal body composition. So there's a bunch of direct and indirect mechanisms. I can see no downside to it.
Beautiful. And guys, if you're learning about medicinal mushrooms for the first time, you know, these are basically health warriors that you can put inside of your body to help bring you back to a state of balance. Our favorite, full disclosure, myself, Dr. Bob, and a number of other people on this call are ambassadors for a company who share the purest form of reishi, Dr. Bob mentioned. It is ranked as #1 in the Chinese medicine category of medicinal mushrooms. It is a powerhouse. It is absolute rocket fuel for the body, particularly the spore powder. Actually, Dr. Bob, could you just share just briefly, what's the real benefits of the spores that our partners Organo actually have patented that really give people an exceptional experience when it comes to the consumption of reishi?
First and foremost, 3 parts of the mushroom. The root system is the mycelium. They call it the internet of the earth. And interestingly enough, when something works in nature, it probably works in your body the same way. So it's really good for the central nervous system. Item number 2, we have part number 2 of the mushroom would be the flowering body. And if they call it Ganoderma lucidum, that is the flowering body. And then we have the spores, and that's how the plant replicates. So some of the most powerful medicinal components of that, the phytochemicals, the botanicals, are 75 times more concentrated in the spores, and therefore they're going to get the most bang for the buck with spores. Now, the spores, I tell people, if we had another ice age, 10,000 years from now, when the ice thawed, we're actually going to have these mushrooms popping up because there's enough nutrition to last 10,000 years, enough antioxidant protection, and 2 very protective shells to protect it from the environment. So the company Organo, our partners, they patented the process through extensive reishi research to find a way to crack both spores and therefore have 99.9% nutrient bioavailability. And the next closest competitor came in at 15%. So we're between 6 and 7 times better than the next. And then interestingly enough, we've got a partnership with IBM. It's called IBM Trust. People can scan a barcode on any of our products. They'll find that they're USDA certified organic, GMP, kosher, halal, no herbicides, insecticides, fungicides, mycotoxins, you name it. We have the cleanest products on the market with the highest nutrient bioavailability. So there really is no comparison. And then our delivery system, another patented process by which we put it in coffee and tea that idealizes nutrient delivery, and by the way, minimizes the acid within coffee, or neutralizes, depends on how you want to look at it.
Yeah, beautiful summary of that, Dr. Bob. Yeah. And the delivery system really couldn't get any easier. Let's be honest, guys. Someone cannot make a lifestyle change of changing out their coffee and tea. I just literally say, I'm sorry, I probably won't be much use to you if you can't make that adjustment as a coach, to be perfectly honest, because it is such a beautiful delivery system and an enjoyable delivery system for nutrition, or as some people know reishi as nutrition perfection. But we have a number of medicinal mushrooms that we share. We have cordyceps. We have lion's mane now with the new royal edition. We have not necessarily a medicinal mushroom, but ginseng as well, which is particularly powerful. But of those 3 I mentioned, Dr. Bob, reishi, cordyceps, and lion's mane, and anything else you would like to add into the mix, what do you believe would be particularly the most effective when it comes to hypertension?
I think reishi has the most data, but keep in mind, you know, the most effective, people ask, what's the best exercise? The one you'll do consistent. What's the best form of a particular nutrient? The one you'll do consistent. So, you know, if they're going to do our king of coffee, our green tea, our red tea, they get the benefits of the spores. And then we start looking at the different parts of the plant, but our new royal, and not royale, as you said so nicely, right? I'm going to have to rewatch Pulp Fiction because I'm trying to remember that part of the movie. And
yeah, the royale with cheese. Yeah.
Okay, well,
there we go.
At any rate, so that's lion's mane, cordyceps, and reishi. And, you know, I did a Facebook Live from my office with a mom. I should have done it with the 11-year-old boy. But here's a kid that was being prescribed attention deficit drugs. And, you know, from age 6. So picture already half of his life, he's been on amphetamines. And there's problems with that. By the way, especially in teen years, they know that it makes these kids hypersexual. It's a dopamine agonist. That's the pathway of addiction as well. But maybe through a mixed blessing, the insurance company said, you know what, we're no longer paying for that drug. We'll give them a generic, but we're not going to give them a brand name. And the generic didn't work as well. So mom said, you know what, my brain feels so good on this royal coffee. I'm going to make him a royal. Now, I don't hear of too many 11-year-olds drinking coffee, but ours was so good. And she puts, you know, maybe some nut milk in there and maybe a little honey and made it good. And from his very first cup, he felt better in every way in that day in school. He says, Mom, I don't ever want to do those, medications again. I want this coffee. And so now it's part of his daily routine. But we look at the big three. Lion's mane is really proven for the brain. And just for the fun of it, I go to PubMed and I realize, okay, there's only 50 plus studies. There's not that many on that. Then we go to cordyceps, 1,000 plus. Then we go to reishi, and especially under the name Ganoderma lucidum, 3,000 plus. So, as we find out more, we'll know more. But Paul Stamets, the world's foremost authority, he says, you know what? Reishi is going to be number one. Cordyceps is going to be number two. Lion's mane, somewhere in the distance, but from the market standpoint, it's the number three most purchased. So I think there's a lot of people that feel that benefit between their ears and say, I want this. And so we make all three available to people in a way that they can enjoy taking it every day. And I'll go to Dean Ornish. She said, sustainable changes must be pleasurable. How many people enjoy a handful of capsules or pills? Not many. How many enjoy a cup of coffee or tea? Almost everybody.
Almost everybody indeed. And for those people who don't drink coffee or tea, we can share the capsules with them as well so they can get the benefits. But of course, if this information is new, guys, and if you're coming in and you're watching this live and you're wondering, what are we talking about? We're talking about hypertension. We're talking about natural solutions. We're talking about root cause. We're talking about bringing you back to your state of balance. And of course, using nature's wonders, if you would call them, medicinal mushrooms, and how they can help us come back or bring us back, or allow the body to heal itself and bring itself back to a state of homeostasis or balance. But when it comes to safety, Dr. Bob, are there any concerns when it comes to any side effects associated with using medicinal mushrooms in regards to hypertension, or any interaction with any medications if someone has gone that route and has decided to take medications? Is there any contraindication with the use of those meds?
Oh, so here's what I tell people, right? We're in 40 countries, and none of those countries have governments that have said, hey, this is risky. Right? They don't cut down the use. They don't give any warnings on medication. They don't even give warnings on pregnancy. So that's how wonderfully safe this is. But now I'm going to throw on my own clinical spin, because here's what I can tell you. I have had so many people over the years that were put on high blood pressure medication. They're told they need them for the rest of their life. But as we start improving their body, their balance, their chemistry, their stress, their toxic load, then they suddenly begin to realize, oh my gosh, I feel tired especially towards the end of the day, or maybe when I stand up, I start feeling not so good. We measure their blood pressure. Maybe they were being medicated for a high blood pressure issue, and suddenly the medication is forcing their blood to an undesirably low level of pressure. And so at that point, now I'm a natural provider, so I don't give advice on medication, but I go back to their provider. I say, tell your doctor, listen, I measured my pressure this morning. It's 80/60. Do you think I can cut back my blood pressure meds? And in every case, they say yes. Sometimes they say cut it back gradually. Sometimes they say you don't need it at all anymore. And I'm surprised when they tell them that, because there's usually a rebound when they stop. But I will often tell them, you know what, we need to measure your pressure every day for a period of time. Let's make sure that's safe for you to do that. And then ultimately, if it's not safe, then maybe we have them get back with their doctor and say, look, I stopped the med and it went way up. How about I cut it in half? And then they cut it in half again, and then they're off. But unless people have had a remodeling of their blood vessels where they absolutely need high blood pressure medication for the rest of their life, the vast majority of people that really take responsibility for their health are able to get off of those meds, and many others as well.
I think that's the best case scenario, Dr. Bob, is if people are having that collaboration with yourself as a functional medicine doctor and a really switched on and aware and holistic GP. And I've seen these GPs and I've learned more about them, around the world and what they do, and the openness to marry both of these approaches. So all the bases are covered, so to speak. As you mentioned, there are cases where people do need medications, but that has to be overseen in a very careful way, so that person doesn't become either addicted or feel dependent or is having a false reading or whatever that may be. So essentially, guys, if you feel looking at this, or you're watching this replay or you're watching live now, that you're constantly being prescribed medication and you're not being asked, what's your lifestyle like? Some of the points that Dr. Bob mentioned on this: lifestyle, nutrition, stress management. If you don't have protocols in place for that and you're just being given a prescription, or you're not even being asked that question, you might want to consider another doctor. because that's something that I would always encourage people to be asked first and foremost, to see if that person has really got their finger on the pulse when it comes to serving you in the best way, the most modern way, if you would, possible. But when someone is looking for medicinal mushrooms, Dr. Bob, you've seen this in your clinic yourself. You've seen people who've come to you, they've tried our partners' supply and brand and have decided to save money and get it elsewhere, like Amazon or eBay or something like that. And it didn't end, but it resulted into being a very dangerous situation for that individual, because what they actually purchased were not medicinal mushrooms and were not what they thought it was. How can you guarantee that people are getting quality medicinal mushrooms? What are some of the certs that you would look for or recommend?
Why not go with USDA certified organic and a GMP processing facility as the very beginnings? And then, what's so fascinating, and I tell people I'm going to give a big shout out to, someone that's one of our business partners, Emily Morrow. And she said, all these companies are talking about the potency and purity of their product. And they're saying they're the best in the market. Let's see. So she took her own money and had these biochemically analyzed. And here's what she found. Our products are more potent. And the number she used was at least 300% purer, cleaner than the next closest competitor. Now, Eric, I got to tell you, 20 years ago, when I wanted to have products tested, I was very blessed to have been partnered with high-level nutrition companies that have partnerships with universities. 2 decades ago, you had one thing tested. It was over $1,200 to get the analysis. It's now basically $50.
Wow.
Yeah. So Emily didn't break her bank to get that done, but how wonderful that she actually stepped up and, did that. And she did it because she was a very curious soul and said, all right, let's figure this out. Let's actually compare them. Let's have an independent third party look at that. I would encourage more people to do that. Now with our IBM Products Trust, they can scan a barcode. They can find out where did the raw materials come, what type of testing, what type of certification. Is there any other company that has that? Not that I'm aware of at this point in time. And then you might ask, why not? Why are they not doing that? Maybe they have something to hide, whereas we have nothing to hide. And so we make it full disclosure to everybody all the time. Now you start talking about Amazon and eBay. Amazon's done so much for the world, but part of what they do is they're essentially a broker or an agency for people to sell any product. And they were sued a few years ago for not successfully screening counterfeit products. And especially in the nutraceutical realm, they felt that about 10% of it was complete and total fraud, even going through Amazon. So, are they getting better at that? I hope so. But simple strategy. If you are partnered with the company that has the highest level of certification that fully discloses it, then you're probably making a really good choice. And I see that one of my favorite humans, Alana McLean, joined Instagram, and she says, hi, guys. Hello, Alana, or as I like to call you, Alana. She did such a fantastic job sharing these treasures. And she had a wonderful friend that had given up on, procreating, on having a new baby. She just gave up. She says, yeah, we gave up. We just got sick and tired of the disappointment. Amazingly, Alana introduced her to our better products. And a month later, she sent her this long message, and it was, spelled out very long and deep. Alana, girl, thank you. I'm pregnant. Now,
Wow.
whatever, more than a year has passed, and they have a beautiful, healthy, amazing baby. And by the way, I think these miracle babies are here for a purpose, not just to add joy to mom and dad, but I think there's a better purpose for them on the world. If nothing else, just to give hope to many people that have struggled.
Sure.
Thank you for that, Alana.
Absolutely, Alana. Smash some love on that one, guys. If you're watching this live, what a testimony. But it just shows you guys, if you can share ideas with people, share strategies with people that can make a big difference, please do. Let them have an experience, and you just don't know what will come back. It's pretty amazing what I've heard over the years, and I'm excited to take this to a whole new level. My final question before I just address the chat and we'll wrap the call, because I know we ran a few minutes over. What are some of the options then that our partners, Dr. Bob, have to offer for people to experience this? And as, of course, you mentioned earlier, quality is king, guys. Quality is king. You get what you pay for. You either pay now or you pay later, but you will get what you pay for in this life. So what kind of options do we offer for people that are intrigued by medicinal mushrooms? They want the best. They want to invest in themselves and their health and their family's health. What options do we share with those individuals?
When people fall in love with our product, which is easy to do, I always tell them there's three options. You can be a retail customer, me, Eric, or anybody else that sent it to you. Guess what? They're happy to sell it to you. Number two, for a small fee, you can be a wholesale buyer. That's basically $50 here in the US. You get everything at wholesale for a year. Or if you're like me and Eric, you can get paid to consume and share these. And you know what? We have a team now of over 26,000 people around the world that have shared over $42 million in health promoting products. And that's a lot of good health. And here's what I'll tell you, the company will wonderfully compensate you for, effectively sharing this product. So retail wholesaler get paid, but Eric, I'm even going to take it a step further. We got into it for the reishi products, but then they bought an all organic skincare company. Then they partnered with a brain technology to create a better brain. Then they bought a travel company, which, by the way, every dollar you spend on coffee or tea goes towards travel credit. And their travel company has the lowest price travel guarantee. If you find something lower, you send them a screenshot, they'll beat the price. And guess what? You get a mega discount just by drinking a healthier coffee or tea. And most recently, they bought an all organic skincare and beauty company out of Europe to bring it in. And very, very simply, the people running this company say, we're not stopping short of sharing as many treasures that the earth has to offer with as many people as it has to offer. Because let's face it, we need better choices and we need better health, and Organo's all about it, as are we.
Beautiful, beautiful. I should have rephrased the question, but thank you for clarifying that. I meant the options for the consumption of medicinal mushrooms, but that is an option for sure. And we will be circling back to that topic this Saturday around the entrepreneurial part of our business. For any of you guys are looking to diversify or seeing what's happening with the world economy and are thinking, I want to focus more on my own economy and look at other ways to create abundance. So please join us on that call. We will share a little bit more in that regard. But in regards to the delivery system, sorry, I wasn't clear with the question, Dr. Bob, but thank you for letting us know. The delivery system options for people who would love to try these medicinal mushrooms. So we've got coffee, we've got tea. We also have sweetened beverages, right? For anyone who loves a sweet treat but doesn't want the spike, could you just share the sweetened options for people as well?
So that's a beautiful thing, right? So our beverages that do have sugar, and let's face it, most people put cream and sugar in their coffee or mocha or latte or whatever we're talking about. I remember one time when I was a Starbucks customer, I was a great Starbucks customer, and I would drink their coffee and their organic coffee, French press. I decided, let me see what people are ordering. Eric, I was in line over 30 people I watched, and I was the only one that got coffee. What did everybody else get? Mocha Frappuccino and other stuff like that. So people are getting it. When they get the dose of Ganoderma, 6 different blood sugar mechanisms, and I have my diabetics measure their blood sugar before and after a mocha. And for the typical person, it raises their blood sugar about the same as broccoli and chicken. I'm looking the Instagram feed, and Nordic Labs Finland has joined us. And, I got to give you a big shout out, Nordic Labs, because you've been adding health to the planet for so long with your amazing fish oils and other products. But guess what? The reason they're on this is because they are thinking about partnering with us to share these treasures. And so we're going to find out if we can find a special way for them to do that, because they are elite and connected, and they're the type of group we want to share with, because they're committed to making the world better. I know you can't reply back, but thank you. I've been a big fan of your products for decades at this point. Got a long history of providing really good, clean, health enhancing products. And who knows, maybe we're going to find some even better synergy in the future.
Beautiful, beautiful, nice. Just wanted to make a comment. We have one question here, or 2 questions here. Let me see where. So we have Charlene. How do you treat an acute episode of hypertension, and what can be taken to avoid experiencing an acute episode of hypertension?
Well, acute might just be your stress out of your mind, and you measure a high pressure. And so we want to calm the person, but understand that sometimes this is a medical emergency. I've had people come to my office 220 over 140. That's extreme. And if they don't commit to go to the emergency room, I want to drive them there myself. Because the last thing I want them doing is blowing out a blood vessel and dying, right? That's not what anybody wants. So remember, first do no harm. And so very often, if someone's in a real crisis, then we go to our friends with the stronger tools. We're not anti-medicine. We're just anti-inappropriate use of medicine. And 220 over 140 is appropriate use. So listen, if it's a high crisis, if you give someone something calming, like a nice GABA facilitator, like reishi, you get them to do a little meditation, a little walk around the block, breathing deep air. And I wouldn't give it too much time. If it's literally acute from a high stressor, they probably know that their heart is beating out of their chest. But once they get calm, you measure it again. And if the pressure is significantly lower, you probably don't have a medical emergency. But if it doesn't drop, the last thing I want anybody doing is making an inappropriate decision and dying for it. So, listen, that's the number one reason that I send people from my office to the emergency room. So,
Wow, thank you.
yeah, if it's that high, don't risk it. Don't risk it.
Thank you for that. I hope that helps, Charlene. Last question as well, guys. If you do have a final question, please put it in the chat and we can address it before we wrap, if that's okay, Dr. Bob. We have one question from Mary. My husband had a heart attack in 2014. Sorry to hear that. And was put on atorvastatin or statin meds, 10 milligrams Zerto, 20 milligrams Merool, 50 milligrams losartan, potassium 25 milligrams, and baby aspirin 81 milligrams. He's doing well now, but concerned about all the medicine he takes. Is long-term medications necessary, or what suggestions would you have?
Not necessarily, if we address cause and effect. And so medical people have standards of care. And heart attack, typically they're going to leave with 6 different drugs. And if my math was right, or just my counting, not even on my fingers, that was 6 different drugs. And they're trying to prevent clotting, and they're giving, blood pressure meds. And then they're also trying to slow down the heart. And, maybe that's necessary, but maybe not all of it is. And so if we get after cause and effect, if we eat right, drink right, think right, move right, sleep right, poop right, talk right, if we get down to fighting weight and we learn to manage our emotions, body, mind, and spirit, then maybe none of those are needed. But we want to work with a team that can do a good assessment and not put him at risk as he reestablishes health. It seems, going back to then, if this is 2014, we're 9 years after that. That would have been plenty of time to get on a healthy program and turn around the effects as much as possible. And I often tell people, I have had people on cardiac transplant lists where we've improved cardiac function fast enough that they were able to get off the list. And I just happened to look, there's a question on Instagram about how much potassium should one take. I'm not even sure what the recommended dose of potassium is, but here's what I can tell you. Your body regulates potassium very tightly as long as the adrenal glands are healthy. When the body can make enough aldosterone, it actually regulates sodium and potassium ideally. But guess what? When the body's stressed out, you may actually lose excess potassium. So you might need a whole lot more. But, from a simple standpoint, there's plenty of foods that are rich in potassium. People might think of bananas. A banana a day ought to be fine as long as they do well with bananas. But, if everything else is regulated properly, then a good multivitamin, whatever little smattering they have of that, should be sufficient for nearly all.
Beautiful. Thank you, Dr. Bob, for clarifying that. Guys, I'm just putting in Dr. Bob's email here. If, let's say, Mary, you need that, or you want to connect in regards to your husband to get that doctor-patient relationship going with Dr. Bob, if you want to work in line with your doctor, and Dr. Bob, that's over to you to nurture that as you do so well. I've just added your email, Dr. Bob, in the chat here, Mary, for you if you want to converse about other strategies, other approaches that, Dr. Bob can do so brilliantly, so you know where the standing is, if that's okay, Dr. Bob. I hope it is fine. I've put that in there. Guys, we seem to be wrapped on that. Thank you so much, guys. Really appreciate you coming here. Knowledge bombs left, right, and center. We will be editing this. We will have this on Dr. Bob's YouTube. You will have this here on Instagram as well in its rawest form. Dr. Bob, legendary as always. Guys, so great to have you on Zoom this coming Saturday, as we mentioned. For anyone with an entrepreneurial bone in their body who sees the potential for medicinal mushrooms, sees the potential for the internet, and sees the potential for themselves creating more abundance, then please join us for our conversation around the business end of things on Saturday, 7:15 GMT, which would be 1:15 Central Standard Time. And for next week, we are just touching on fighting seasonal allergies with medicinal mushrooms and going down that road for you to help educate you on how that can also alleviate issues with the airways. Dr. Bob, thank you so much for sharing your time with us today, your knowledge, your expertise, and your love for all things human development. I'll leave the last words to you. Guys, great to have you on Instagram. Thank you for sharing some love. DM us if you have any questions or queries. And of course, reach out to whoever invited you to this call if you're on Zoom, or if you've come to Dr. Bob's Instagram, reach out to him in regards to our one box challenge, or likewise on Reishi Warriors. If you come through our channel, drop us a DM and we'll share our one box challenge with you directly. Dr. Bob, over to you, sir, to wrap up the call.
Yeah, my great mentor, Jim Rohn, taught me well. He says, when you give a talk, wrap up with 4 questions. He called them questions to ponder. So here they are. First question is why? Why'd you take the time to join us today? There's so many things you could do. Second question is actually the answer to the first. Why not? Why not learn about real strategies to enhance every aspect of your health that are easy and delicious? Third question, why not you? Someone's going to say, this makes a lot of sense. I'm going to step up my game. I'm going to step up my coffee. I'm going to nourish my body, mind, and spirit with every sip. And the final question is, why not now? So the longer you wait to act on information, the least likely you are to act on it. If someone referred you to this, go back to them and say, I'm ready for my best life. Help me get started, and we'll help you with that. So with that said, in that part of the world, good night and God bless. In this part of the world, good day and God bless. And just continue to make our wonderful world better as only you can.